Hi, I'm Ryan Ackerman. I'm the interim senior leader for practice education in Vancouver, and I'm joined today by Jeanette Ziegler, ACP and paramedic practice educator from Vancouver and Fraser, and Leon Baranowski, paramedic practice leader. Welcome back to the second part of our systems-based patient assessment course. In the first module, we covered scene assessments, primary assessments, secondary assessments, a basic introduction to the human body systems, and a picture on how we're going to integrate various body system assessments into an overall clinical picture of the patient. And as we move forward, we're going to start to take a bit of a deeper dive into each body system and start to fit that more and more into our clinical picture and incorporate those assessments. But before we did, I want to do a bit of a Q&A with Jeanette and Leon about how this systems-based patient assessment framework fits into and supports our practice as paramedics, and how it will help the health system and the patient as a whole. So I'd like to ask you guys a couple of questions, if that's okay. So Jeanette, can you tell us, why are we adopting systems-based patient assessment, and what does it mean to me as an individual paramedic?
So implementing a systems-based approach is fairly familiar to our critical care environment, but unfamiliar to some of our field paramedics. We tend to approach our patient assessments from a problem-based approach, which might be all right for someone with a single complaint, or particularly for our trauma patients. But when we start to look at patients that are more critically ill or have more complicated body systems, we do have to consider how the systems integrate, and that the respiratory complaints also affect our cardiovascular systems. This is applicable for all of our patient population because oftentimes, especially within Canada, we don't get to see our family physicians very often. So we have conditions that we're not diagnosed with. So it's important that when somebody appears to complain of a single system, that we start to look at the other systems to see how they're connected and how that can affect our patient care.
Excellent, thank you. So Leon, can you tell us a bit about what the benefits are of incorporating a systems-based patient assessment approach are to the paramedic and the system as a whole?
Yeah, sure. So Ryan, as we start to integrate further into the healthcare system, it becomes really important that we all start to kind of talk a common language and that we all share the same knowledge base. And so for consistency and in our documentation and the way that we record this information, the transition of that care and the handover of that care as it goes forward starts to build a clearer picture. So when you hand a patient over, when you've done a systems-based assessment, you're talking that same language to a nurse, a physician, a colleague, maybe somebody in the community. And it's better for patient safety, it's better for patient outcomes, and it also helps us with our ongoing research in the way that we kind of pull this information from our electronic patient care records, so we can make these improvements and spot any gaps in practice going forward. So like as a system, there's a lot of benefits to ensuring that we take a standardized approach to a number of things, including system-based approach.
Excellent. I understand that the systems-based approach is sort of the standard in hospital, particularly in the emergency and critical care environment, in terms of how patients are assessed and information is conveyed between practitioners. Is that right?
That's correct, yeah. And when you walk in as a paramedic and you're able to kind of articulate and explain what you've done and your findings, the receiving centers will pick up on the use and change in your language in this model, and that will help kind of make sure that everybody's looking for the same things and providing the same standards and level of care.
Excellent. So Jeanette, you mentioned previously being trained in a problems-based approach to patient care or patient assessment. And I know that was certainly the way that I was trained as a paramedic. I wonder if you could tell us a little bit about how switching to a systems-based approach impacts the care that I can provide.
So often with a problems-based approach, we tend to do our ABCs, and then we do what is considered the primary, a head to toe, and then the secondary. And we often divide those up into what's done on scene versus what's done in the ambulance and en route to hospital. And anybody who has worked and has some experience underneath them starts to see that this needs to be adapted in order to actually work in the field. And we don't always break it up by that primary, secondary, head to toe. What the systems thinking process allows us to do is to take those pieces of what previously is considered in that secondary and apply it into our primary, bring forward kind of those focused cardiovascular questions into the chest pain patient, while also integrating some of our respiratory and our GIGU in order to kind of rule in and rule out what's happening with the patient. The paramedic industry is evolving, and we're transitioning from a technician approach to more of a clinician approach. And the systems-based approach allows us to become more of that clinician in our environment. We start to think more holistically about the patient, about what's affecting them on their day-to-day, how their chronic illnesses affect their current complaint, and the acuity of that complaint.
Excellent. So Leon, in the last question I asked you, you briefly touched on the importance of handover reporting, and I wonder if you could elaborate a little bit on what that means for the individual paramedic and how that is impacting care.
Yeah, so linking it back to the systems-based approach, it all comes down to that commonality in our language and the consistency in the way that we're handing over this care. And there's a lot of work going on right now within BCHS, and people may be aware of the new clinical practice guidelines that support more of a structured approach to the way that we hand over patients. And that's because handover is a critical time when we transition the care from one healthcare professional to another. And that's when kind of most pertinent pieces of information can be lost that may actually affect the patient's ongoing care and treatment that they receive. So when you're handing over in a systems-based manner and you're working through the different findings and systems that you've identified, the receiving site will understand that information probably more clearly, because again, we're all speaking the same language, and it will support and aid in that transition of care, and again, reduce the chances of any information being missed, as well as supporting safer patient care and safer clinical practice. So that's one of the the big advantages to using a systems-based approach between other healthcare professionals and providers.
Excellent, thanks. So Jeanette, I know you were one of the people who spearheaded this project for systems-based patient assessment, and I know you and others have done a ton of work, Leon, as well. It's part of the reason why I'm talking with you guys today. I wonder if you could give us a bit of your experience now that some people have begun to absorb this information and start to try and apply some of the initial lessons from the first module. Have you noticed any interesting changes in practice as a practice educator out there in the field?
So we've identified the benefits of a systems-based approach, and they go beyond just structuring of the assessment and the patient care management. They also go into our communication with the emergency department. We found that with our handoff reports to other healthcare providers, we are a little bit smoother in the way that we're communicating, and we're looking at the patient more holistically, which means when we're handing off, we're actually providing more information in the same format that they're used to hearing it. So in the past, we know that paramedics have kind of had to adapt their way that they hand off their reports. And the ones that have gone and taken a little bit more education in regards to anatomy and pathophysiology have been able to adapt a systems-based approach already, which has improved this communication. And that's certainly what I've seen in the field as well, is that the more information we know about the systems, then the more that we can gather out about patient complaints, which will of course improve both our management as well as their communication with the hospital.
Excellent. Yeah, and that's a big part of the reason why we're starting into our next modules, which are taking a much deeper focus into each body system. Well, thank you both for your time and all of your work on this course. I know I'm really looking forward to moving through into the next sections, and I really do think this is an opportunity to start to really think critically about patient assessment and how we integrate our assessments into patient care. For those of you who are moving on to the next module now, thank you for taking the time to go through this course. If you have any questions at any point, feel free to reach out to your paramedic practice educators by emailing learning@bchs.ca, or you can reach out to your paramedic practice leaders at any time through clinicalpractice@bchs.ca. Enjoy the course.